Hey guys, Dr. Paul Goodkin here. Thanks for checking out this video. I'm doing a whole bunch of videos on a series regarding sports injuries. That's one of the things I really like to work on here at the office. I get great results. The patients love coming in because it gets them back into competing or participating, even if they're not competitive athletes, gets them participating back in the things they love to do, whether it's tennis, golf, jogging, CrossFit, or the martial arts that we do. I'm here with my friend and master instructor, Vagner Rocha, UFC fighter, and just the nature of his business, he's always got some kind of injury that we're trying to get through, and I'd like to think that I'm part of the team that keeps him performing and competing and able to continue to do what he does. Today we're dealing with a couple of injuries, specific injuries. We've got a hand injury and a knee injury. We're going to go ahead and do a laser treatment on both of them, and then I'm going to do a full body adjustment, and I'm also going to check out the joints in the hand and the wrist and all that stuff. You'll see it as the video goes on. I don't want to be too long-winded. So let's go ahead and begin. The laser I use is a high-powered laser, and there's a lot of talk about cold laser. This is not cold laser. This is a completely different animal. The high-powered laser, between its wavelength and its power and its frequency, actually gets deep to the cellular level and promotes healing at a rate that your body couldn't possibly do on its own. With Vagner here and a couple of other athletes, I don't want to sound silly about it, but they call it the miracle machine. Specifically even with Vagner, he tore some rib cartilage, and in 2 sessions, I think he forgot about it. Whereas typically, we all know that could be a 3-week injury. Just keep the pattern going here. All Vagner or any patient feels is pretty much a pleasant sensation of heat. Not painful at all, right?
Not if you don't stop it. It makes it quick.
Each treatment per body part's about 7 minutes, and that'll take care of that area right there. Now I want to work on the knee. Same thing. And even though I know Vagner's injury is down here, I want to work on all the tissues surrounding the area. We're promoting healing by bringing increased blood flow there. And also, like I mentioned earlier, this is a high-powered laser. So what we're actually doing is getting healthy tissues to form far faster than they normally would on their own. So for all intents and purposes, we're increasing the healing factor. Good. And each one of these, like I said, each segment is about 7-8 minutes, depending on the severity and the chronicity of the injury. Glasses. Now what I'm going to do is check out the injured areas. All right, let's take a look at Vagner's wrist. I can see that it's swollen compared to normal, and it's also bigger than the other side. This is a fresh injury. This happened Tuesday night at training. So let's go ahead and get things adjusted here. I don't know if you can hear that on film, but everything just released. I want you to lay back. I want to take a look at this knee here now. My normal knee protocol is let's figure out what happened and then how we're going to fix it. So I know there was nothing acutely traumatic. So nobody smashed him here, kicked him here, something like this. It's been kind of building up. It's a little bit of a chronic issue. So what I'll start with is the muscle test. I have twist in, don't let me twist out here, and it's easy to blow out. So what I've determined now is that we've got a misalignment here, which is causing problem in the knee. So we're going to bring this up. And again, I don't know if that made it on video. Real nice movement there within the joint. Bring it in, don't let me twist out. Full power now. So is the pain going to be gone immediately? Maybe, maybe not. But the fact of the matter is now he's functional. He'll be able to move properly, he'll be able to train properly, and the pain will go away on its own in a day or two, especially in light of the laser. He'll probably ice it tonight. We've got it adjusted, and that's it. That's how we're going to treat a wrist injury and a knee injury on this patient today.